Good afternoon and happy Sunday. Thank you for tuning in this afternoon on this Sunday. For those of you like me and my family who are missing going to church services today, my thoughts and prayers are with you, and know that we're going to do everything we can to resume communal faith-based settings as soon as we can. But in the meantime, let's all say a prayer for one another and remember how important it is to be kind and loving to one another as we get through this crisis. Today, I want to make a note that it is just the fantastic Dr. McDonald and me. The reason is because I wanted to give Director Smiley and Director Alexander Scott just a bit of time to breathe this afternoon, but rest assured they are healthy, they are well, and they are working hard every day to protect the people of Rhode Island. I try once in a while to give people a break whenever we can. As you can see from the data on the screen, today's a good day. We saw a bit of a decrease day over day in our cases. Now, one day doesn't make a trend, but I'll take it. I'll take it. It's certainly better than the alternative, which is going up. And I think it's, for me anyway, it's a sign of hope, and it's a sign of confidence that we've been doing the right things, keeping people safe, and that there is light at the end of the tunnel. So I hope you will share in that hope and in that confidence. Obviously, we still have more cases and more fatalities, and that is something we have to bear in mind, but it's a good thing. It's a good day in our fight against the coronavirus. Just a few announcements today. It's Sunday, so I'm going to endeavor to be brief and not take too much of your Sunday afternoon. If you watched the briefing yesterday, you heard me talk about how the arts are just so important in the fabric of our state, and the arts can uplift us and inspire us and provide us comfort and bring us together as a community. That is true all the time, but it's especially true in times of difficulty like the times that we're experiencing now. And I would encourage you all to turn to the arts, whatever that may be for you, art, dramatic art, dancing, some kind of creative expression and outlet, I think can provide great comfort and connectivity as we go through this. So today I want to let you know about a new virtual exhibit that Waterfire has started. And I have to say a huge thank you to Waterfire. This was their own initiative. They took the initiative and came to us with it. It's a special installation called Beacon of Hope, and it's intended to honor those who we've lost in this pandemic. Every Rhode Islander that we've lost is represented by a luminary, and it's a beautiful, moving tribute to the human cost of this pandemic, and I hope it brings some comfort to loved ones. You can view the work 24/7 at waterfire.org, waterfire.org. I would say that there's so much that is difficult through this crisis, but one of the things that I have found to be particularly heartbreaking is that we have to change the way we grieve. And so during this period, the social distancing restrictions have even applied to funerals and other services. Despite that, we've lost many loved ones. So it is I'm grateful to Waterfire, and it is my hope that we can all as a community take a moment to remember the lives of those lost, and I hope that this provides some comfort, especially to the loved ones who have lost someone to coronavirus. I want to take a second to talk again about mental health, and I have tried to mention this pretty regularly in my press conferences. The fact of the matter is, what we are living through now quite possibly is going to be one of the hardest things we ever lived through. Certainly in Rhode Island history, certainly in my lifetime as a Rhode Islander, and maybe in your lifetimes as well. It's a public health crisis. It is an economic crisis. It's enduring, it's changing the way we live, and so with all of that comes mental health issues. And we don't want this to also turn into a mental health crisis. So in the best days, when the economy was doing well and things were quote unquote normal, Still, we have so many loved ones who struggle with mental illness, anxiety, depression, other kinds of mental illness, addiction, those in recovery. It's tough on a good day. It is very tough as we deal with the added anxiety which has come with the coronavirus. Now, I know that because I'm hearing from you, and so that's why we're working overtime to make sure that even though we're going through this, we still have the community supports for Rhode Islanders of all ages, by the way, from the littlest among us to the most senior. And so I want to just say a few things. Number one, as my husband would say, it's okay not to be okay. If you're feeling like you need help, I want you to reach out. If you're missing your normal support group that gets you through a given week as you are on your recovery journey, if you're struggling with addiction, if everyone in your family has been laid off and the added anxiety and pressure of that is just becoming too much, I don't want you to feel isolated. I don't want you to feel ashamed to find help. And I want you to know we've actually added resources so that we can meet the extra needs of Rhode Islanders. So I want to tick through a few of the specific things that we're doing to remind you of ways to get help. I'm also talking about it here at the podium so you know it's happening all over the place. It's not just you, it's everyone. And it's, as I said, we want you to reach out just as the same as you would reach out if you broke your arm and needed to go get help for that. So number one, insurance companies, I did an executive order, so this is not optional. Insurance companies have to cover telemedicine. That means if it's a phone call to a therapist or a doctor or a social worker must be covered by the insurance company in the same way as it would be covered if you were doing an in-person visit. So the fact that you might feel reluctant to go into the office should not deter you from getting an appointment. You can do it simply by phone, or if you have some video capability, you can do it that way as well. I want to remind you again about BH Link, Behavioral Health Link. It's a 24/7 hotline and triage center for adults in crisis. That phone number is 414-LINK, 414-LINK. Call there anytime, day or night, if you're an adult and in immediate need of mental health services, and they'll get you the help you need. They'll assess what you need and get you the help you need. Now for children, we also have set up a 24/7 hotline for kids in crisis. That's called Kids Link, and that number is 1-855-543-5465. And I'd like to thank the hardworking folks at Bradley Hospital. Bradley Hospital has been operating Kids Link for some time, but I reached out to them and said, could you make that a clearinghouse, a one-stop shop for the entire state? And they agreed to do that. So if you're a kid and you're hearing this and you're feeling angry, depressed, suicidal, like you just need to talk to someone, or if you're a parent and you know your children need more support, call Kids Link and they will match you up with the appropriate level of care. And they're doing a terrific job reaching into the community to make sure that we have excess capacity in the system so that they can match you up with a therapist or doctor or other mental health professional in the community. I would say that to me, the most inspiring thing about the crisis so far has been the everyday acts of kindness and generosity that happen every day, millions of times a day. I see it. I see it all around me. I hear about it. I see it on social media. I see it in the stories of people saying, Governor, I'd like to make this anonymous donation. Governor, how can I help do this? But I want you to remember this. As much as we have to be taking care of our neighbors and our friends and our family, don't forget to take care of yourself. Don't forget to find time to go for a walk, read a book, exercise, meditate, watch a movie, get the mental health you need, because this is going to be a marathon. Even when I say the stay-at-home order is lifted, it's not going to be back to normal. We are going to be living with this virus for a while, which means we have to adapt to it. And part of being able to adapt and being resilient is each of us keeping ourselves strong and healthy and educated. So don't forget about you and doing what you need to do to keep yourself strong and healthy throughout this. I want to also take a second to thank all of the mental health providers in Rhode Island. Your jobs are difficult on a good day. They're extraordinarily difficult now. I see that every day too. You're going out of your way to be creative, setting up new call centers, setting up new ways to meet the needs of your patients, doing telemedicine. That's new for a lot of you, I realize that. Figuring out how to do Zoom calls with your patients. For those of you who do the really extra difficult work of working in communal settings, in DD group homes, in some of our DCYF group homes, on the wards at Hasbro, on the wards at Butler, I just want to say thank you. You are unsung and often unseen heroes in all of this, and I've got my eye on you as some of the bravest people in this fight, and I want to thank you for all you're doing to keep Rhode Islanders safe and strong and healthy. I also want you to know we're going to keep doing a better job of getting you the PPE you need and the support you need, and I hope for the lowest paid among you, you're going to get the raise that you need and deserve as well due to the announcement I made last week. So God bless and thank you for all you do. Two more quick announcements. I want to make an announcement about the Veterans Home. We all always owe a debt of gratitude to our veterans. Having been raised by a veteran who served in the Second World War, that's something that was just bred into us. And it's something that I believe, and I know we all believe. That has been never truer than it is right now. What am I talking about? So the other day, we had our first positive case in our Veterans Home in Bristol, followed by our second, one with a patient, one with a staff. This can be scary. We all saw what happened in Massachusetts, and I'm going to do everything I know how to do to make sure that doesn't happen here. So to give you some comfort, I just want to address this head on. And I do want to recognize this is a difficult situation. This is an older population living in close quarters, many of whom have severely compromised health conditions. But despite all of that, we're going at it with gusto to make sure we keep everybody, residents and staff, healthy as possible. So we have a full-fledged response in place. The Veterans Home has quarantined residents who live near the resident that tested positive. They're going to be cared for by a designated staff that will arrive and leave work through a separate entrance. The sick resident is no longer in the facility, and we are doing a thorough contact tracing effort for everybody who could have been or was in contact with the resident that tested positive. All other staff and residents are being tested. So yesterday, today, we're going to test everybody. Every resident, every staff in the Veterans Home will be tested. And we've put in place a team from the Rhode Island National Guard on site to provide additional support for the home. So this is a big deal. We're on it, and we're going to do everything in our power to make sure that it doesn't get out of hand and spread and cause the fatalities that we've seen in Massachusetts and other places. To those of you who have loved ones in the Veterans Home, I want you to know how seriously we're taking this. We didn't waste any time. We got the National Guard team in there. We've tested everybody. We've quarantined the other folks, and we're doing everything we know how to do to keep your loved ones safe. Finally, last note, since it's timely, I've said this so many times, but it cannot be overstated what a tough time this is for small businesses, many of whom have closed completely due to the crisis. So I just want to remind everybody that on Friday, the President signed a bill to put more money into the Payroll Protection Program. This is money available for small businesses. They're going to start processing that tomorrow. So if you haven't already reached out to your banker, you really need to do that immediately. The way to access the funds in this program, if you're a small business, is to call your banker. If you have an existing line of credit, an existing banking relationship, call that person today if you haven't already done it. Now, some of you, especially the smallest businesses, have said you don't have an existing banking relationship. So we have set up a separate and special product just for you. And the way to get that is to send us an email at ppp@commerceri.com. ppp@commerceri.com. And we're going to do our best. We will work with speed to get you connected to a financial entity that can get you the loan. But I can't emphasize enough, you got to move fast on this one. And starting tomorrow, they're going to be starting to process. For those of you who have been able to access the loans, I've heard great things, that it's money that is sorely needed and being well spent. So and it allows you to keep your employees working, which is something I'm begging every business to do to the extent possible. Keep as many folks on your payroll as possible, as long as possible. So thank you. Stay strong if you run a small business, and let us know how we can help. With that, I'm going to turn it over to Dr. McDonald.
So thank you, Governor Raimondo. And I want to say good afternoon to my fellow Rhode Islanders and to all those who join us from outside Rhode Island to follow the Rhode Island story. In terms of our COVID-19 data, we had 310 new cases. That brings our total to 7,439. Regrettably, we've lost 11 more of us. And that doesn't get easier to say every day, just so you know. One of those folks was in their 50s. 4 of these folks were in their 70s. 1 were in their 80s, and 5 were in their 90s. 10 of these good people were from nursing homes. I want to just share a little bit of context in total about the pandemic, though. It was only 119 days ago when the first patients were ill in China. And it really has only been 57 days since patient number 1 was diagnosed in Rhode Island. So just as context here, it's still a relatively new disease. We're still learning a lot. And although we're learning a lot, there's still a lot of unanswered questions. But I like the progress we're making, and I think we're heading in a good direction together here. Having said that, I know it's a difficult time for everybody, and our routines aren't, quite frankly, our routines anymore. It'd be normal right now to feel a little bit frustrated and a little bit like, what am I doing here? So one thing I think we can do, though, is take this time to optimize our personal wellness. So let's look at things that we can do during this season of illness to start looking at what can we do to go on a worthy journey of personal wellness here. So let's just start at the top with oral health. We're supposed to brush our teeth for 2 minutes twice a day, and I think a lot of us are good at doing that twice a day, but I don't think a lot of us are good at doing it for 2 minutes at a time. And the 2 minutes really matters. Dental hygiene is important. I don't want to be a dental emergency, and you don't either. And my toothbrush has a 2-minute timer built into it, but just a 2-minute timer just to make sure you brush your teeth for that time. It sounds like a small thing, but we have to keep in mind, we really have to take care of, the teeth. It's hard to keep the doctor away without good teeth. My little expression, an apple a day keeps the doctor away. We got to have good teeth to eat that apple here. So let's work on that. It's something we can all do. Exercise is really important too. One thing about exercise, it helps our lungs and our heart to be stronger, and we need that. It's just important to keep our fitness up here. And the weather's the weather. Some days are great, some days not so much. But we're hardy New Englanders. We can get out, we'll get out. But you can do stuff in the home too. We all learned exercises as kids we can do. just try to be active in your home and get active. An hour a day of exercise is what we're all shooting for. So let's work on that a little bit if we can. And then I want to talk a little bit about immunizations. A wellness reminder for our kids. It's important that our kids get vaccinated against these childhood diseases. The director highlighted yesterday some of our concerns about the little bit of drop in vaccines we've seen. And one of the things I've heard from the pediatricians is that parents are a little bit reluctant to go to the doctor's office right now. So I just want to address that a little bit. The pediatricians have taken measures to keep your children safe when they come to your office. So the childhood vaccines are important. We want to make sure we get those. Just to give you some numbers, when I look at March 2020 numbers compared to last year, so month to month over a year, just that month, 39% decrease in our measles, mumps, rubella vaccines, a 20% decrease in our polio vaccines, and a little bit larger, 52% drop in our menactor, our meningitis vaccines. It's just 1 month, so we still have herd immunity in the state for these diseases. And keep in mind, we can achieve herd immunity for these vaccine-preventable diseases. This we can control. And I think during a time when so much of it feels like it's out of control, we should focus on what we can control. So some of that is just our own wellness and things we can do to protect our kids, and those are good things we can do. So I want to end with an easy way to make sure you're keeping socially distant here. And I think you've heard the expression, I want to keep somebody at arm's length. That's an old expression, right? So if you look at me putting on my arm there's the governor right there, and she's going to put out her arm right now. Thanks, Governor. And there's a little gap between us there. Guess what? We're more than 6 feet away. You can do this anywhere you go. And I think this is a little bit easier to do than, walking around carrying a tape measure. And I just think that's one way we're just like, where you're going socially, rather than kind of saying something might be, construed as unkind, just put out your arm a little bit, and then we know we're all good, and then we can just move on with our day, and nobody gets their feelings hurt. And I just want to say that I'm going to turn it over to the governor for questions. Thank you, Governor.
That was very helpful. We should do this. Come on, Margie, you and I.
Dr. McDonald, we'd love your weekly demonstrations.
We do. I love this guy. He's fabulous.
Thank you, Margie.
So you may recall yesterday, it was beautiful out, sunny, relatively warm. With that in mind, Christian Winthrop from Newport Buzz says Newport was inundated with traffic yesterday. In 1 hour, nearly 300 out-of-state cars were counted driving on Bellevue. When posted to Newport Buzz social media, a spirited debate was ignited. Many claim your quarantine order is unconstitutional or doesn't apply if they own weekend homes. Your thoughts on this?
So that is very concerning, very disappointing, and I'm going to have to make sure we get some more enforcement and presence in Newport. It's also very wrong. So the quarantine order is in effect. It is the law, and if you have come here from another state to reside in your second home, that's fine, and we want you here, but you have to follow the law. The same way that when you're here, you have to follow any other law. We are asking you to do the right thing to allow us to keep Rhode Islanders safe and healthy and be in quarantine. So I will remind you that we right now are in a situation where anyone coming from any other state by any other mode of transportation, car, anything, when you come to Rhode Island, you are ordered into quarantine for a period of 14 days, no exceptions. And I appreciate I forget who the question was from, but I appreciate you letting us know that because it's not okay. This right now, I just explained, today's the first day we've had a little bit of a decline. We might actually be at a place of getting this thing under control. And for those of us who do live here full-time and work here full-time and make our livings here full-time, it's really important that we get back to work quickly, which means we all need to follow the rules. So I'm happy that you're here. We want you to be here, but we need you to be safe, and we need you to follow the rules.
Our next question is from Ian Donis of the Public's Radio. Supporters of loosening restrictions say the risk of doing this is limited since about 80% of deaths are related to nursing homes, and that's where the vulnerability is greatest. Do they have a point? If not, why not?
Well, I'd say yes and no. I mean, it is certainly the case that the greatest risk is to people who are older or who have underlying health conditions. And as you say, and as the doctor just pointed out, the majority of our deaths are in nursing homes. Having said that, we also know that if the virus gets out of control, it mushrooms and would completely overtake our healthcare system. So, for instance, it wasn't really an option to not clamp down. You know, the statistics around that were horrifying, of how many millions of Americans would have been lost and how overwhelmed our healthcare system would have been. So now, when we reopen, the reason I feel confident that we're reopening, and when you say the risk is lower, I agree the risk is lower, because we have much more testing, we have added hospital supply, we're doing contact tracing, we have places for vulnerable communities to isolate, such as the homeless. So the risk, there's no doubt about it, the risk is greatest to the oldest and most frail among us, which is why we have to continue to really protect that population. The young and the healthy are soon going to be able to go back to work, but under different restrictions, so the virus doesn't blossom the way it has in other places. And also, our system's ready. You know, God forbid, if we have 1,000 more folks going to the hospital, we're ready. I don't think that's going to happen, but we're ready, which is what gives me the confidence to say, you know, I'm really looking forward to lifting that stay-at-home order on May 8th, because everything I know now tells me we're going to be ready.
Alan Gerberti of WBOB asks, does the governor's new fund to increase wages of healthcare workers allow for home care workers to gain access to the same fund for much-needed wage increases that support the risk of their lives to care for COVID-19 positive patients in the community?
It's a good question, and thank you for asking. It does not. It doesn't mean that there won't be other initiatives in the future to shore up other parts of our healthcare system, but this particular fund, which by the way starts tomorrow, is specifically designed to meet the immediate crisis needs of low-wage healthcare workers in communal care settings, group homes, nursing homes, assisted living, and the like. I still have hope that Congress is going to do something to help the rest of the healthcare system, and we're in constant contact with home care, hospitals, et cetera, to monitor whether at some point in time we might have to do more.
Our next question is from Alexandra Leslie of WPRI Channel 12. How many businesses, if any, violated the face covering executive order in the past week? How was compliance from customers?
That's from, who's that?
Alexandra Leslie from Channel 12.
Thank you. So I have to get back to you, Alexandra. I don't have a number off the top of my head, but if you call in to the call after, I'll get a number for you. Here's what I do know. The Department of Business Regulation has done many hundreds of unannounced spot checks on businesses. They've done, I think, 500 or 600 over the course of the week, just showing up unannounced to see how compliance is. And they report to me generally excellent compliance. So I don't have a number for you exactly how many, but in general, we're seeing excellent compliance by both customers and employers. So I should say thank you. You know, I know it's awkward, it's a strange thing to go out of your house with a mask, to go grocery shopping with your mask, but the more we learn about the virus, we were just on a call yesterday, the more we learn about it, it's actually quite effective. And so we have to keep doing it. And as far as everything I know, people are complying.
Next question's from Lynn Arditi. Governor Raimondo, how do you do contact tracing when hundreds more residents are getting diagnosed each day? Is there any point at which the disease is so widespread in the community that you'd stop doing contact tracing?
A great question. How do you do it is with a lot of effort and a lot of people. So this week I'm going to be talking about the details of the contact tracing system and symptom tracking system that we're building. A lot of it is technology, so we're trying to make it as automated as possible to track symptoms and track contacts. But candidly, it's a very manual, intensive operation. So we already have over 100 people full-time. All they do is contact tracing. We had a meeting yesterday to talk about how we can get more state workers involved in contact tracing. I suspect by the end of this, we will have hundreds of people full-time doing nothing but contact tracing. I think in Massachusetts, they already have over 1,000 people, similar numbers in other states. Will we get to a point where we stop? I don't know, but if we do, that's very, very far away. I think the answer is no, actually. And in the meantime, it's building a very robust system so we can do it. This provides me with an opportunity to remind everybody, use your contact tracing notebook every single day. So this is your reminder for today. If you haven't done it in the past few days, please go do it. Pull out your notebook, write down, where was I yesterday? Who was I in contact with? Because again, this is hard. So if you get tested positive, someone's going to call you and ask you, where have you been? Who have you been in contact with? And this whole process is only good insofar as it's accurate, which means every one of you, me too, my family, same thing. Write it down. It takes 30 seconds. Do it while it's fresh in your mind, and it will save lives.
Nancy Thomas of RI News Today says that Governor Cuomo this morning said that as they open up the state, phase 1 and phase 2, they'll have to be careful to not lure people from other states or regions. How will Rhode Island address that issue if it can?
It's an excellent point that the governor makes, and it's something we're thinking about, and I'll have more to say, if not this week, a week from tomorrow. We know from our own experience in Rhode Island, from the experience of other states and other countries, that some kind of border control is essential to this effort. Now, obviously, we can't interfere with interstate commerce, we have to respect people's rights, we have to allow business to happen, but what the governor's pointing to is an excellent point. The way this is going to really come to bear in Rhode Island, and I don't have an answer, but I want you to know we're thinking hard about it, is of course the summer tourist season. So how do we strike that balance between allowing for some tourism without risking another major surge in the disease? So we're working on it. I suspect the answer is going to be a lot of contact tracing, and new regulations and limits, and very good enforcement around, as Dr. McDonald was saying, social distancing, mask wearing, et cetera. And to the point that came up earlier, anyone who comes to Rhode Island has to obey the rules and laws in Rhode Island.
Alan Gabberty of WBOB has a multi-layered question for the doctor. I'll start with, can someone who tested positive for COVID-19 and recovered contract the virus again?
Yeah, so you're asking the question. And this is the most important question to me, because what you're asking is, do they have immunity? And the answer is, we don't know. And this is extremely important, because when I talked about vaccine-preventable diseases, I talked about herd immunity. That means many of us are protected from getting that. With COVID-19, no one knows this yet. And part of why I gave you the context about first patient 119 days ago, we don't know what happens a year later. And so we don't know. In Rhode Island, we haven't seen folks test positive a second time. But keep in mind, we're only at day 57. And so part of you asked the right question. It's funny, you remind me of a rule in medicine, which is what you don't know can hurt your patient. Well, this is something we don't know. This is a public health question that really matters here. We're going to learn together on this here, but it's something we're looking for very carefully, and it's something you'll see across the globe people are looking for very carefully. And when I look at the testing work stream that I've been involved with, this is something everybody's going to be looking at.
You answered the second part of his question, and that was, have any Rhode Islanders tested positive a second time? He goes on to ask, have any Rhode Islander residents who've tested positive for COVID-19 also tested positive for the flu?
You know, it's funny, you bring back a memory of mine from the first, maybe it was the second weekend we were dealing with this. There was someone who was diagnosed with the flu, and the doctor said, well, that's the answer. But then the other doctor said, I'm going to check. And sure enough, the person had both. So you can get both at the same time. And so it's something where this is something that can happen. Now, we aren't seeing flu all that much in Rhode Island anymore. Keep in mind, flu is seasonal, and so flu is really on the way out. So we're not seeing flu right now as much as we used to, and that's encouraging. But I want to make this point. If you have what you think is the flu right now, achy, you get a cough and a sore throat, and I feel kind of achy, you probably don't have the flu, my friend. You probably have COVID-19, and that's where you need to interact with your healthcare provider, get tested, and let's get you isolated and get your loved ones quarantined.
Our next question is for the governor from Rob Burkowski of the Warwick Post.
Sure.
He asked what company provided Rhode Island's 20,000 COVID-19 antibody tests being validated. Are they FDA authorized, or have they received FDA emergency authorization?
Yeah, so we did get 20,000 tests. They have received FDA emergency authorization, and this is one of the things we're looking at with all these serology tests. So the director and the governor have put together, I think, a dream team of people. I'm going to miss everyone's name, so I'm not going to name anyone, but I was at a great meeting yesterday with a bunch of very smart physicians across the state and pathologists and lab experts about looking at just this question, which is what are the best tests for us to have? What are the best ones to do? And part of it gets into a very important concept of when you get a test result, it's really important that you know the result is true. And I don't want to get into high-level statistics, but what I would say is when you get that result from the doctor, if you were told you have the disease, you want to know, do I really have the disease? And if you don't have it, that you really don't have it. And this is where we talk about false positives and false negatives, and it gets confusing really quickly. But quite frankly, part of what this team is looking at is what is the best test for Rhode Island? What is the best way for us to sample the population? And how should we go about doing that so we answer the question I got earlier, which is, gee, how many people really had the disease? What was our prevalence? Prevalence means the number of people actually had it. And then we can start deciding long-term, what if we found folks who had it and then had it again? These are important questions that we can answer. So I guess I've answered your question with more questions, but that's the way public health works, my friend.
And our last question today for the Sunday briefing is for the governor. California is giving the undocumented immigrants a check for $500 to help during the pandemic. Many Latinos must go out to work because they don't qualify for any benefits. Given the high numbers of COVID-19 cases in the community, would you consider a similar message? And this question comes to us from Liza Gordon of Noticias, Rhode Island.
Thank you, Liza. This is something that is weighing very heavily on me right now. We had a great meeting or virtual meeting on Friday with my advisory group of Latino leaders, and we are working together to figure out the best ways that we can support the undocumented community. I can tell you we're doing an awful lot around food delivery. In fact, we just had a huge distribution on yesterday, or Friday maybe, to the undocumented community, working very closely with Mayor Diosa to figure out how we can help folks. So we're doing more. We're going to continue to do more. That could be an idea. We're going to be open to a number of different ideas. I do want to say a few things about this. I know there is fear in the undocumented community, and I understand that. But I'm begging with you, please, to go get tested if you are sick. I promise you will be safe if you do that. I have said this in the past. You might show up and see people in uniform. These are not ICE agents. These are people there to help you. It is free. We want you to get tested. We want you to get health care, and we are going to protect you. I'm going to be talking a lot more about that this week, but it's an important message, and to the leaders in the Latino community, please help us get that out. Second point, many members of the Latino community, particularly women, but many members, work in these low-wage healthcare jobs. They are exactly the people we're talking about who work as CNAs or nurses' assistants or cleaning folks, food service in nursing homes, hospitals, and the like. And many of them also live in, small apartments, crowded apartments. And so here's what I want you to know. Let us know so we can get you a free, safe, clean dormitory at Brown University. If you're someone who's a healthcare worker, documented or undocumented, and you feel it's just not safe to live in your house, maybe you live with 10 other people in a small house, maybe your grandmother or aunts and uncles or elderly people are in the house, you probably shouldn't be living with them because you don't want to spread the disease. So let us know so we can get you a place. Brown has graciously offered, this is free, it's free to you, and we are not going to ask about your immigration status. You are a Rhode Islander who lives here. We want to take care of you and your family, and we want to make sure you get the health care that you need and deserve. So I'm glad you asked that question, and we're going to be talking a lot more about this. By the way, for the rest of Rhode Island, not only is this the right and humane thing to do, it is the necessary thing to do to keep all of Rhode Islanders safe, because we are learning every day that the experience of other countries is that when you have a blind spot about certain communities who sometimes live in the shadows, who are not taken care of, that can lead to a surge which hurts everybody. So we're serious about this, and we're going to continue to get after it.
Thank you, Governor.
Happy Sunday. Enjoy your day.
Nice to see you.
Thank you so much. You have to work every day. Thank you.